One of the greatest features of Iris is the reminder recall feature. This allows the user to run labels or letters for patients that are coming due for shots or those patients that are past due. Reminder and recall notices can be generated for each patient provided that the following conditions are met. The status is active in the patient information section for your organization. Also, that the Allow Reminder and Recall Contact indicator in the patient information section is yes. The patient has the complete address information listed in the address information section. If a patient has an insufficient address, they will still be included within the report, yet many of the outputs will not be generated for this patient, such as a label or a letter. To select and submit reminder recall criteria for patients, you will need to fill in the criteria on the reminder request screen. Follow these steps. Click Reminder Recall under Reports on the menu panel. Iris only uses the tracking schedule recommended by the Advisory Committee on Immunization Practices, or ACIP. Therefore, selecting to use the tracking schedule associated with each patient or a uniform tracking schedule for all patients will be based on the ACIP recommendations. In the Vaccine Groups section of the screen, indicate whether you wish to include all vaccine groups in the search criteria or if you wish to include only selected groups by clicking the appropriate radio button. If you choose to include only selected vaccine groups, select these groups by double-clicking a group or highlighting a chosen group and clicking the Add button. Do this for each group desired. Age criteria. Age will be calculated as of the current date. When this criteria is indicated, both a from and a to age will be required. Indicate with whole numbers the age in months or years. The from and to boundaries will be inclusive. Accordingly, patients falling exactly on the age boundaries will be included within the report. Should you choose to run this by birth date, you need to input a from and a to birth date as well. Indicate the dates in months, days, and years format, or use the calendar icon to select the dates. By birth date, boundaries are inclusive. Accordingly, patients whose date of birth falls exactly on either boundary will be included within the report. The status criteria is a specification of whether to narrow my search by currently due or past due, or due in the next however many months. Currently due or past due. When this criteria is indicated, patients will be returned based on two different criteria. The patient is or has passed the recommended date for an immunization within the vaccine group, and the tracking schedule criteria indicated within the report. And that a patient can still receive the immunization for which they're due and have that immunization considered valid by IRIS, meaning they have not passed the maximum age requirement for that immunization. Due in the next however many months. When this criteria is selected, patients will be returned based on whether they have a recommended date for an immunization within the vaccine group and tracking schedule indicated within the report and occurring within the indicated number of months. This report has the option of searching 6 months forward using this criteria. To generate the report, press the Generate button. Depending on the number of patients associated with your provider organization, it may take 5 minutes or more to generate the data for the various reports. While the data is being generated, the Request and Output status screen indicates the percentage of completion. Press Refresh to update the data. Waiting for reminder reports. A note: once you reach the reminder request status screen, it is not necessary to stay at this screen while your report is being created. You may go anywhere in IRIS while the report is generating and may return to the status screen by clicking on the Check Reminder Status link under Reports on the menu panel. Likewise, you may close out of Iris and return to the status screen by clicking on the Check Reminder Status link after logging in again. When the report is complete, you may click on the blue underlined date to go to the Reminder Request Process summary screen. The summary screen lists the number of patients involved in the search and the criteria that were used to define the search. From the summary screen, you may create reminder output options. You will see on step 3, patients that are active within my organization and allow reminder and recall contact reads directly from that patient record where we made sure that the patient's status was active and that they were going to allow the reminder and recall contact within Iris. The Reminder Request Output Options table found on the Reminder Request Process summary screen allows you to choose how you would like to use the data from your query. Reminder letters, mailing labels, patient query listing, and some other custom letters are available for your clinic. The Reminder Letters Output option allows you to generate a standard form letter for the parent or guardian for each patient returned on your query. The letter allows room at the top for your organization's letterhead. The body of the letter includes the patient's immunization history and recommended immunizations and due dates. There are up to 2 lines for free text and a telephone number. To generate the reminder letters, follow the steps. Click on the reminder letter, which is underlined and in blue text. Your report will be listed on the Reminder Request Status screen. The bottom table shows the name of the request, the date and the time it was started, and the status of the request. If you choose to stay at the Reminder Request Status screen while your request is processing, press refresh occasionally to check the status. Once the status says ready and the report name is underlined and appears in blue, your letters are ready to be viewed. When you click on that, it will open up in Adobe Reader. To print the letters, find the printer icon on the Adobe Reader toolbar, click on it, and press print. To cancel, hit the cancel button. And to go back to the Reminder Recall Request screen, you can hit Enter. Mailing labels. The Labels Output option produces 30 labels per page on Avery Mailing Labels 5160. To generate mailing labels, follow these steps. Click on the mailing labels, which is underlined and in blue text. Your request will be listed on the Reminder Request Status screen. The bottom table shows the name of the request, the date and the time it was started, and the status of the request. You may have to click refresh a number of times should you choose to stay on the screen. Once the report name is underlined and appears in blue text, your labels are ready. Click on the report to view or print the labels in Adobe Reader. To print the labels, press the printer icon on the Adobe toolbar. Press OK or Print in the dialog box. To print additional output, press the back button on your browser at the Reminder Recall Request Status screen. Click on the underlined report request to return to the Reminder Request Process summary page. The patient query listing is probably the most commonly used reminder recall output option that is recommended by the immunization program. This query listing displays contact information for the patients included within the Reminder Recall report, as well as an immunization history and recommendations based on their tracking schedule. This report lists every patient that was returned in the report query process, regardless of the address information on file. You may have to click refresh a number of times while you are waiting. Once the report name is underlined and appears in blue text, your report is ready. Click on the report name to view or print the report in Adobe Reader. You will notice that every patient that was included in the Reminder Recall request is now listed. The patient is listed by name, date of birth, address information, and whether or not that address is valid. If the address is not valid, it's because the address was not included on the patient record. This report shows the vaccine group, the recommended date that they should have received the immunization, and the dates that those immunizations have actually been received. It is a good idea to run this report first to see who all is listed in your Reminder Recall criteria. You can also use this report to go into the patient record and potentially change the patient's status from active to inactive should they no longer be a patient at your clinic.